Joining me to talk more about this is Dr. Nancy Simpkins, a board-certified internist. Thanks for being with us today.
Thanks, Betty.
All right, so Thomas Eric Duncan's family has been given the all clear. Is this going to help ease some of those fears that perhaps Ebola could be spreading?
I think this is really good for the American public because I think there's a very fine line between concern and panic, and I think many Americans have crossed the line now into panic. I think we need to bring it back into an educated concern. The fact that the quarantine of 21 days is up and they are free and roaming around and there is not another new case will reassure the American public.
Well, what are the main points of concern, if you will, then, in your eyes?
I think the main point of concern now is dealing with the epicenter, which is Africa. I think we cannot control the virus, the spread of the virus. We need to put the money and resources into Africa and do exactly what we're doing here in the United States with the CDC and the NIH and the Pentagon's new response team. All of this will protect the American public. I mean, there are 5,000 acute care hospitals in the United States that need to be trained. They need to implement the training, but really controlling the virus must be at the epicenter in Africa.
So what about the airport regulations and travel bans and things of those type? Not going to work, or will it?
No, I'm not a fan of the travel ban for a few reasons. It sounds good to the American public, and all of us, it sounds like, oh, we'll be protected. But really, in truth, we won't be, because people who want to travel from one African country to another, those borders are very fluid. They will just go to another country then and make a travel.
And then you kind of lose track of where exactly this person originated, and maybe it just slips through the crack.
Exactly.
So it could be a bigger problem, perhaps.
Right, or they'll go underground and they'll wind up getting here and we won't be able to track them. Is the airport screening going to work? We don't know, but we're going to try it.
All right, quickly, I want to ask you about this Pentagon strike team that we've been talking about today. How effective is that going to be? Because doesn't the CDC have something similar to that?
Well, this is a ramped up version. Remember, the CDC was working on the World Health Organization's guidelines. They were doing the best they had in place. They now are going to issue some new guidelines as soon as hopefully today for all hospitals. But this Pentagon team that's being put together is doctors, administrators, Defense Department, all the teams working together under our new Ebola commissioner and czar to try to coordinate all this. It's a coordination effort, and I think it's a good attempt, and I very much support it.
All right. Well, Doctor, thanks for joining us this morning. We appreciate it.